Coverage. UHC is a program that has been adopted by successive governments, now each employing different strategies to facilitate its implementation. However, despite its ambitious vision, the initiative has seen minimal progress. Key challenges such as lack of political goodwill, financial constraints, inadequate human resources, and communication gaps have been identified as major obstacles to its success. So, what must Kenya do to ensure the successful implementation of this critical program? Well, our health and science reporter Elizabeth Atieno explores the path forward.
On the 12th of December 2012, the United Nations General Assembly endorsed a resolution on global health and foreign policy urging countries to accelerate progress towards universal healthcare, UHC, to ensure that all people have access to the full range of quality, affordable and accessible healthcare. Kenya, led by the then President Uhuru Kenyatta, launched the UHC program on the 12th of December 2018. The pilot was conducted in 4 counties of Isiolo, Kisumu, Machakos and Nyeri. The pilot progress was then reviewed in October 2019, after which a national rollout was launched. Among the 55 recommendations suggested by Health Financing Reforms Experts Panel, appointed in 2018, was a legal framework within which NHIF operates to align its processes to UHC. Therefore, the NHIF Act of 1998 was amended and became law in 2022. The defunct NHIF had 14 million registered principal members and about 12.9 million dependents, translating to approximately 22.8 million beneficiaries. However, there were only 11.6 million active beneficiaries following the existing provision of voluntary membership for the informal sector. This equally posed a hurdle in the implementation of UHC, which required every Kenyan resident to be a registered beneficiary and contributor to the National Health Insurer.
NHI was not able to cater for the health of all Kenyans because it was only left to those who are earning through the payroll. But we know there are those people in business who are earning more than those in the payroll.
We have that culture that we don't value health insurance as a primary need and a primary within our budgets as Kenyans.
7 years later, and the UHC rollout dream appears to be a pipe dream, even with the launch of a new health scheme, SHA, rolled out in October 2024. The Ministry of Health has since maintained that they are on the right track towards implementing UHC.
It is not optional, but it is a must. Taifa Care has the potential to completely transform our health sector.
However, the UHC implementation in Kenya is faced with a wide funding gap. For instance, in the 2024-2025 budget, the health sector was allocated a total budget of 127 billion Kenya shillings, with 4.2 billion Kenya shillings allocated for UHC coordination and management unit.
The exchequer doesn't have the money, and so you're finding at times the hospitals are ceasing to offer SHA services. There are several other issues. So at times we just assume that it's not working, but there are several very definitive issues that are being tackled as they arise.
Another key challenge in the rollout of UHC is in human resource, considering the UHC health workers have spent most of their days in the streets protesting over poor working conditions as they demand to be employed on permanent and pensionable terms.
The other day it was UHC, yesterday it was clinical officers, tomorrow we don't know who else is coming. Kenyans out there are making a lot of noise about SHA and UHC. But the ministry seems, the ministry seems not to be moved.
Kenneth Njeru is a health expert and the director of Africa Afia Healthcare. He says the failure of UHC implementation is largely caused by the communication gap between the government and Kenyans, as well as political interference.
Think of it this way. Put yourself in the shoes of a common mwananchi who doesn't understand the jargon, who doesn't understand how insurance works, and is just saying on the TV it's not working, you know. And they were not going to get into details. So there is so much negative publicity on this system such that now people are not interested in contributing.
Even with the failure of UHC in countries like Kenya, countries as diverse as Rwanda, Brazil, France, Japan, Thailand, and Turkey have shown successful implementation of UHC.
We are comparing it to systems in other countries that have been there for decades. I mean, NHIF has been here for 5 decades. So why are we judging a system that's been here for 5 months and saying it's failed? It will take time, and there are several factors that play on, and they bring up a multiplying effect, so as it's struggling to reach its optimum performance.
In order to deliver on the UHC promise, the World Health Organization has urged countries to have strong, efficient, and equitable health systems that are rooted in the communities they serve, with primary healthcare cited as the most effective and cost-efficient way to get there. With the challenges currently facing the country's health sector, especially with the new health scheme, SHA, the question that now lingers in the minds of many is, will Kenya ever experience the successful implementation of UHC? Elizabeth Atieno, TV47, Nairobi.